Welcome to the third season of the Stronger Than Autoimmune podcast. As an autoimmune warrior myself, I understand living with chronic illness isn't easy. You're not alone. This podcast is made to give hope. I will interview individuals living with autoimmunity along with experts and businesses to help provide knowledge and support. As a health coach, I understand there is no cure for autoimmune disease, but creating small changes to lifestyle can influence how we feel. And shout out to all my listeners out there because this podcast is made possible by you. And how can you support? Glad you asked. There are 3 ways to show your support. 1, rate the show on Spotify. 2, leave a review through Apple. And 3, share the episode with a warrior so they too can have hope and be stronger than autoimmune. And enough of this intro, let's get started. Dr. Smith, I am pleased to have you on my podcast. And you're an ear, nose, and throat doctor, and you're based in Houston. But the thing about Dr. Kevin Smith is that he has specialized in a revolutionary nasal procedure, and he understands the connection between nasal health and athletic performance, which is amazing. The procedure that the doctor targets is the root cause of migraines, a deviated septum. Septum? Am I saying that correctly?
Yeah,
okay.
Deviated septum.
His approach goes beyond symptom management. He is dedicated to unraveling the connections between migraines and underlying nasal abnormalities. His research and case reports have shed light on the impact of nasal surgery, not only on migraines, but the connection to neurological conditions like Parkinson's and Asperger's syndromes. So let's get started. Let's talk.
All right, let's dive in. Thank you so much for having me. I really appreciate it, Desiree.
Yeah. Well, if you want to start from the beginning as a college athlete.
Sure. Yeah, I happen to be a football player. I played at the famed Dallas Carter High School that's featured on Friday Night Lights and 30 for 30 what Carter lost. So I was a quarterback, and I got a scholarship to the University of Michigan, which is where I did my pre-medical education. Once I finished there, I came to the University of Texas at Houston and did my medical school and my ear, nose, and throat residency, and then did an additional year in facial plastic surgery. So I can do facelifts, eyelids, nose jobs. But in addition to that, I do a lot of sinus surgery, nasal surgery, some work for sleep apnea and things like that. So I started out and when you do sinus surgery, invariably some people have headaches. And I would do these surgeries and their headaches would go away. But after a few years, I looked at the data, and about 90% of the people who came to see me actually had a history of migraine. Now, I don't diagnose migraine. You come to me with it, and I do my procedure, and the migraines go away. But initially, because I was taught in medical school that migraines originate in the brain, I was confused and perplexed. I'm like, okay, if these people came with a history of migraines and they're now gone, then maybe these are migraine imposters or migraine-like headaches or migraine-type headaches. I would always connect the two because I know that migraine sufferers, if they don't hear the word migraine and you just talk about chronic headaches, they consider themselves outside that box. So because I did that, I eventually went on television on the doctor's show with a woman who had migraines for 41 years.
Ooh.
And she was 5 years migraine free. And so we're talking about all her symptoms. We're talking about how she got better. She's talking about how she's got her life back. And on the show, I just said, people can have access to my expertise by just getting a sinus CT scan and sending me the disc. I'll review it, let you know if you have the abnormalities that I know she had and other people had that caused the pain. Lo and behold, I get hundreds of scans and they all had the abnormality. And that's when I realized, wow, this is the root cause of migraine headaches. You can't ignore the numbers. I mean, these are all random people across the country sent me their scans. They all been diagnosed by some of the top neurologists all over the country. And they all had the abnormalities. So, I mean, the numbers just dictated that I was actually eliminating migraine headaches with a nasal surgery to correct not only a deviated septum, which is the most common abnormality, But it also includes trimming turbinates if necessary. These are the air filters in the nose, and also doing some sinus surgery if indicated as well. So there are some people that actually have a normal septum who I do a procedure on, and their headaches go away too.
Oh, wow. So
Yeah.
if they don't have a deviated septum, what is going on
Hmm.
to cause the headaches
Well,
or
you
migraines?
have yeah, chronic headaches and or migraines. You have these structures called turbinates that are very sensitive, and they act like the air conditioned coils inside the nose. So when you're on your period, for instance, they swell. When you're pregnant, there's water retention and they swell. When you have a cold or a flu, they will swell. If you have an inflammation like autoimmune disorders have, these structures will swell. So in those people who have a deviated septum for sure, they will get chronic headaches and migraines. Um, but if you don't, then it's really imperative that I look at the turbinates, because the turbinates, when they touch even the normal confines of the nose, can trigger chronic headaches. And so I can liken it to the original COVID test we took that would go deep inside the nose. Those things would really hurt, and they would hurt until it was removed. So, in a sense, what I'm doing with my surgery is normalizing people's noses. I'm not doing anything abnormal. I'm taking an abnormal nose and making it normal, and and removing their permanent COVID swab, and then the pain goes away. So that's a very simplified way to explain it,
Mm.
um, and it works. It works. I have a 90% success rate with my procedure that I call the Smith sinus migraine technique. It's something that's been evolving and developed over time. There are now some things that I do today that I didn't do maybe 10 years ago. And it'll continue to evolve, because it really bothers me that I'm not at 100%. 90% is a very good number, but I question, why is it the other 10% don't get better? What is it I'm missing? Could there be something else that I just don't see right now that I'll learn later on? And that's just a process of practicing medicine. You want to practice it and observe the reaction
Yeah.
to what you're doing, and then utilize it in a positive way, which is what I've done.
Yeah. And it sounds like having that experimental mind, what is working, what's not, and how do you how do you get better?
That's right.
And do you get that from being a college athlete or being an athlete? Is that experimental mindset
Well,
or
Well, I think the persistence and the dedication and the hard work is what I get from being an athlete. I mean, when I went through medical school, I really used to take on exams like I was taking on a game or practice. It was something that, it was a challenge that I needed to overcome. And so I really did utilize what I learned in playing sports to get through medical school, and for sure to get through residency, with all the long hours, the sleep deprivation, the amount of material you have to learn, the memorizing, and the how to do certain procedures and all of that. You really have to have something to fall back on. So I was very fortunate, having played football and having really gotten to certain points. You get tired, and you have to still push through. And so I think the perseverance, more than anything, is something I was able to extract from my athletic days, and I use it to this day. I mean, some days I'm just tired, and I just have to forge through it and get certain things done. And as a private practitioner, not only am I the surgeon, but I have to make sure my business is running right. So it really is taxing. It's very difficult, because things change from year to year as far as medical practice goes, and rules and regulations, and but you just hang in there and you do it. And I do it because I love it. I really do love what I do. This is actually my passion and my purpose in life, that I found when I can give people their lives back, you know, and they've been devastated for years and years, and they've tried everything, every medication, Botox and chiropractors and therapy, and all those things are good. Don't get me wrong, all those things are good if they work, but to know that I can do a 1 hour procedure. It's a 1 hour surgery. It's covered by insurance. The recovery is about a week or two, and a 90% success rate. It's just, I love it. I'll be doing it the rest of my days. Maybe not the
yeah.
surgeries, but I'll be working on expansion and training other surgeons, and really getting the word out, because in the United States, there are about 40 million people with migraines that could benefit from what I do. But worldwide, there are 1 billion people that have
Yeah.
migraines. So it's incredibly a large number. So I've got to get to work and stay at work and and get the word out.
Yeah, yeah. Migraines don't discriminate, right?
No, they
They're
don't. And they'll be here forever because the nasal abnormalities, a majority of them are acquired by injury to the nose.
mm,
Even coming through the birth canal is the first trauma to the face. Then as you go through life, sports injuries or car accidents or things like that. People being more active nowadays, like children playing more sports, you get your nose hit and you're going to have these abnormalities. So they'll continue to cause problems in people, but we have to know how to identify them and then how to correct them properly. I think it's very important to say that I know what to look at on a scan. I have patients who come in who say either their ENT saw something on the scan and didn't think it would cause a migraine for 30, 40 years. The procedure takes about an hour to do. It's covered by insurance. I'm doing a septoplasty and sinus surgery and things. But, I was talking about how other ENTs, they just don't understand the association between nasal abnormalities and chronic headaches and or migraines. And it's so at this point, it's very important that people send me the scan and have me do the procedure because a septoplasty done for somebody to help their breathing is totally different from my technique to help somebody eliminate their migraines. And it just is. It's very detailed and intricate. So until I can train some people to do it, people to get the best chance at that 90% success rate, they need to come and see me. And we had people from all over the country. I had Steve Harvey sent me his business partner from Dubai, and people come from other countries, Mexico and Canada and Cayman Islands and things like that. And so it's pretty exciting. But yeah, it'll require me to train more people and have doctors know how to identify these specific abnormalities that I know that cause the problem. Yeah, yeah, it's really remarkable. It's social media helps, things like this really help. So again, I appreciate you having me on the show. Interesting. Wow. Yeah, that's a silent migraine. If you don't have any pain, there is a silent migraine where people do get aura, but you're having a sensitivity or a trigger from the light. And it's more than likely the inflammation from the autoimmune disorder is likely starting to flare up, which is then starting the nose to flare up. And you likely have, some mild abnormality in the nose that once it gets revved up and you get the swelling, then you start getting the headache or whatever that goes along with the other achy joints and things that you experience. Mm-hmm. Mm-hmm. They do. Well, as far as the migraines are concerned, again, we talk about the nose and the inflammatory process and those turbinates swelling. Women have that monthly menstrual cycle, and again, when you have that, the hormones are raging, the water is retained, the tissues in the nose swell, and if you have any abnormality like that, you can certainly get the headache. So that plays somewhat of a role, I believe. The other one is men likely might have the same number of headaches and migraines. They just don't complain about it. A lot of them, they don't want to go see anybody about it. We don't know about it. They don't want to go to the doctor, so that might play a role as well. And also, I think when you look anatomically, a man's nose is typically bigger than a woman's nose. So any minor abnormality that might occur in a woman's nose might be more magnified because there's just not enough space in there to accommodate that. Where with a man, they could have a little abnormality and they don't get contact with the turbinates, and so you don't see as many. So there are a lot of reasonable thoughts behind why women suffer more so than men when it comes to
yeah,
migraines.
that makes sense. And as
Mm-hmm.
far as like a deviated septum, I mean, for people that don't understand the anatomy of a
Mm-hmm.
nose, can you kind of
Yes.
describe that?
Yes. So between your nose, the columella here starts the septum, and it's made of cartilage in the front, which is why you can move your nose from side to side. But halfway back, it turns into bone. There's bone
Okay.
in the back that grows when we grow. And so it's a partition that divides the right and left nostril and the right and left nasal airway when you get further in the nose. So when you get any type of injury, the first trauma might be coming through the birth canal. Some babies come out, their nose is crooked from either one side or the other. But you could have an injury in your nose be straight. But the septum inside can be a little bent. And as you grow older, it bends more and more and more and more until you get a problem either with breathing, sinus infections, chronic headaches, or migraines. And as we get older, of course, playing sports, soccer, basketball, with elbows flying everywhere, football, all of those things can contribute to nasal abnormalities. And then you have car accidents and things like that as you get older. Um, and a lot of people with traumatic brain injuries, when they sustain these significant head injuries along with abdominal and long bone injuries to their limbs, uh, they usually are left with chronic migraine. And a lot of times, as doctors, we pat them on the back and say, "Oh my goodness, yes, well, you had that horrible brain injury, and that's just part of it." My contention is absolutely not. Those people need to be evaluated with a sinus CT scan because they likely, whatever that big injury was, they likely hit their nose on a dashboard or somewhere, but it just took a back seat to all the other more serious injuries. But now they need to be worked up just like anybody else with a migraine. Get a sinus CT scan, send it to me, we identify the abnormalities, fix them. And now you don't have any more migraines that were thought to be associated with this traumatic brain injury that you had to just live with.
Yeah, yeah, and you don't have to go through all that medication and hurt your gut. I mean, it seems like it's a domino effect, and
That's right.
if you could get away with all that.
Right, right.
You also talked on your website about a migraine and a migraine imposter. Can you talk about what those are? What's the difference?
Well, that was early on in my career when I didn't think they were migraines. I called them migraine imposters.
Oh, wow.
I've written a book called The Migraine Imposter. It has a lot of good science in it. It talks about what I was thinking about at that time. And I just updated the book, so it'll be available on Amazon pretty soon. I did a little forward to it and kind of updated to say that the information in the book, although it's good, I understand a whole lot more now than when I first wrote that book. I guess it was like 14 years ago. So it's time for an update. So I just updated with a little forward, a little addendum to it to say I know a whole lot more now than I did then. But it's a great book and kind of takes you through some of the scenarios with patients, testimonials, their stories behind their migraines, how they got migraine free. But then it also has some good science, which I love, which talks about some of the ear, nose, and throat uh, doctors who have been doing studies on the nose and referred pain to the head for years. They call it contact headaches, but nobody has really committed to say that migraines are caused by the same thing. It's always been thought that it's a neurological issue in the brain. However, it's very important to realize that 95% of all brain scans done on migraine patients are normal. It doesn't show anything. Usually
But they're
would think
not. Oh,
it's
go
normal.
ahead.
95% are normal. So that tells me it's not there because
Yeah.
100%, almost 100% of sinus scans in a migraine patient, when I look at the scan, I will find the specific abnormalities that I know cause the problem. So
Yeah.
the problem's in the nose. I mean, the numbers
Yeah.
just bear out again. You can't ignore the numbers.
Yeah.
I've heard
Yeah. And
somebody
that makes
say,
sense.
yeah, yeah. So
That's
yeah,
science.
it's science.
But those are two different types of scans. You have an
There
MRI
are. Mm-hmm.
and you're looking at the brain,
You're looking at the brain.
and then you have a CT scan, which is a different machine.
It is. It is.
And you're looking at the bony structure, or is it
The bony structures, the soft tissue interface for us in ENT? The CT scan is much better to look at because it can show us more subtleties in the structures of the sinuses in the nose, and we need that. I can read an MRI as well. I will actually tell some people if they don't have a recent scan or have trouble getting a sinus scan, just send me your MRI of the brain, and it may go low enough to show me the nose. And if it doesn't, I'll just let them know that they have to get a sinus scan. But when you're talking about migraines and chronic headaches, think about it. The head encompasses the brain, but it encompasses the nose and sinuses, the teeth and the jaws, and the neck. The neck can refer pain. So you're really doing an injustice in a patient with headaches if you're just going to get a brain scan. But that's the area of focus for neurologists because they have no need to get a sinus scan. So that's why I think it's incumbent upon all of us, the dental surgeons, the oral surgeons, the ENTs, the neurologists, to work together with somebody, and even the spine surgeons, to work together to find out what's the root cause of the problem. I'm a big root cause guy, and a lot of times we'll skip over the root cause and start putting appliances in people or doing these unnecessary procedures when just addressing the root cause of the problem will get rid of them. Okay, very good question. And I think about that a lot because I'm only as good as the last surgery that I do. And when people come in, I have gone to my office manager after seeing somebody who did get better and say, are we really helping people? I mean, and I mean it. And she goes, Dr. Smith, and the whole staff like, Dr. Smith, no, remember Mr. So-and-so, he came in here the other day. He said how well he's doing now. He's back at work. And, or somebody who was suicidal or depressed or disabled couldn't work. Now they have a job. I'm like, okay, all right. But several things could be contributing to that. One, there might be something else in the nose and sinuses that I'm just not seeing at this point. I just haven't learned it yet. I just haven't recognized it yet. I just haven't figured out its importance. That could be it. Two, I have wondered whether or not chronic pain for a long time might induce some type of PTSD in patients or some neuroplasticity changes in the brain, where even though I've done my procedure, the brain is still giving out signals that we're still making pain or something like that. So in some cases, I might send people to a therapist just to see whether or not they have is there some kind of way that a therapist can break through and help to change that morphology in the brain or not. So I've started to do that. And then I might bring them in years later and say, let's get another scan. I just don't believe you're not better. Let's get another scan and make sure nothing's changed or I didn't miss any scar tissue or something like that. So I'm always thinking about that. It bothers me. But then again, the 90% also helps me deal with that because I know I'm helping 90% of the people.
Yeah. And that's quite a bit of people to really be helping. I mean, I don't know anybody that has that type of guarantee, I guess you could say, or outcome. So what is the, I know we talked about before we got on the connection between Parkinson's.
Well, not
and
only that,
Asperger's
I had some people who had, they have these hemiplegic migraines. We'll start there. Hemiplegic migraines, they resemble a stroke. These people can get blindness in one eye. They can get slurred speech, stuttering, seizure-like activity, tremors and numbness in their limbs, paralysis of their legs, can't walk, fainting spells, blackout spells, sleepwalking. You name it, they can get it. Okay. So I had a young lady who'd had migraines for 9 years. And every time she would have her menstrual cycle, she would have these blackouts and all the other things that I just described. Okay. So she came to my office. I did the scan. She had the abnormalities. I do the surgery and she's much better. All those other symptoms went away. She doesn't get that happening when she has her menstrual cycle anymore. So I'm like fascinated, like, man, what's that about? Doing some research and reading, I find out that migraines are associated with at least 75 neurological disorders, to name a few: epilepsy, MS, Parkinson's, Alzheimer's, ALS, cerebral palsy, Lyme disease, chronic fatigue, irritable bowel, Crohn's disease. And so the list goes on and on. And so, but nobody knows the association. Why do they occur together so often? That's the question. And in an MS patient, 50% of them have migraines. And when you look at lupus, somebody like that, lupus has about 30%. They all have their numbers. So just so happened to have a MS patient come to my office 2 years ago, and she also had migraines. And the best thing is she worked for a neurologist. So there's no question about the diagnosis. All right. So I don't diagnose it. She came to me with this. I did her surgery. It's been 2 years. She's not had a migraine, and she's not had an MS episode that she used to get every 6 weeks. She'd get this foot drop and foot pain and stuff. So that's gone. So I'm like, okay, I observe again.
Wow.
I'm doing a procedure and observing the results. So I looked at 3 or 4 Parkinson's patients. I've screened them with a sinus scan. I offer screening at my office. Anybody out there with any one of those neurological disorders that also have migraines, and even if you don't have migraines, if you want to get a sinus scan, send it to me. I'll look at it, let you know if you have the abnormalities. We do the procedure, and I'm just going to have to see what happens. That's how we get progress. That's how we make medical discoveries. So I had 3 or 4 Parkinson's patients. They come in, they get screened. They all have the exact same abnormality as my migraine patient. And it just so happened this week, Monday, I did a surgery on a Parkinson's patient. He had this bad tremor in his left arm and leg. He also has headaches. He also has sleep apnea. So I'm going to be able to help him with all those things. So the day after his surgery, and I'm just waiting to see. I never asked. I just said, I'm just going to let him tell me. The day after surgery, he goes, I don't have my tremor anymore. I said, really? Oh, okay. Well, that's good. How are you feeling? Um, I said, that's really nice. I said, but you have to understand, I just did the surgery. I injected the nose with anesthesia. You've had general anesthesia. So we got to get all that medication out of there. You're taking pain medicine. Maybe that has an influence on it. Knowing that he's likely taken pain medicine before, he's probably had other surgeries and who knows. But anyway, and so the days have gone on. I think he's on his 4th day now after surgery. And he told me that I think the second day, the third day, that it had come back slightly, but nowhere near it was before. And he actually posted something on my social media where he said, it's so much improved that I actually have forgotten that I have Parkinson's. And I'm like, wow, why do you say that? I asked him. And he goes, well, with that tremor, it consumes you every day, because you have to really focus on movement, my walking, where am I going to sit, how am I going to get there. It's just always on my mind, he said. And now that I don't have the tremor, or it's very, very, very much improved, I don't think about it. I don't have to. He said his leg pain is better, his back pain is better, and his neck pain is better. But I told him we're going to have to watch it, because we gave him steroids. I gave him steroids after surgery. That reduces inflammation. So we just kind of have to see. We have to give it time to play out. But we're going to record all of this and just see what happens. And so it's very, very exciting. I've screened a dementia patient, same abnormalities. Asperger's, autism are related to migraines, and we happen to have an Asperger's patient come in, same abnormality, got his procedure, and now he's able to hold a job down. I mean, it didn't cure him or anything, or didn't reverse anything, but it helped. It helped him to be able to kind of just settle in and be able to focus where he could work and hold a job. And so those are the things that I'm doing regarding research, early research, to see what is this connection between migraines and these 75 plus neurological disorders. It is amazing.
That's amazing. I think more doctors need to talk to each other, and
Yep.
You all go to school together, right? So
Yes, you're exactly
all of
right.
a sudden
I
everybody's
have a
divided.
neurologist that has sent me several patients who had these deviated septum and nasal abnormalities. He understands it. He sends me a few that he sees, and he goes down, he looks for it on occasion, but he doesn't understand that everybody needs to get a sinus scan, all of the migraine patients. And so I've talked to him, and I'm warming him up, and I'll joke with him and say, hey, are you ready to win a Nobel Prize? Let's work together and do this, and so eventually I get him on board. But, I've reached out to doctors who specialize in migraines to see if we could work together, knowing that, the medications and things don't work for everybody. And the neurologists, they see it as being very controversial. They don't believe they see a lot of it. Of course, my answer is you wouldn't see a lot of it because you're not a nose expert. You don't look at the nose. You don't know about the nose. Just like I am not a brain expert. I don't look at the brain. I don't know anything about the brain. But I do know about eliminating migraines, and neurologists are experts in treating migraines. So, and not everybody can have surgery. Not everybody wants to have surgery. So it's very important to have all those things available for people. But I would love to work together with a neurologist that sees not only these migraine patients, but also who has a few patients with these neurological disorders that we just screen. Send me 10 patients, we screen them, we see what they have, I fix them, we see what the results are. It's very easy. I mean, to me, it just seems so logical.
Yeah, I mean, I mean, a scan doesn't. I mean, yes, it's
but insurance covers it.
But
I do them for free in my
if you
office.
have
I do screening scans for free.
Oh, go ahead.
I'm so dedicated to looking at it, so you don't have to worry about expense. I do the scans for free. If you want a scan, come to my office, get the scan, and then you can become a patient if you have the abnormalities. So again, there's no excuse now. The scan can be done in anybody who's concerned about anything, from neuropathy through all of those neurological disorders. Mm-hmm. Mm-hmm.
Hey, take it. Might as well. Wow. And anything you think is important in connecting these, because you talked about two things just right now.
Yeah.
Well, a little bit earlier, you talked about sleep apnea, and then you talked
Mm-hmm.
about
Mm-hmm.
the neuropathy. So neuropathy
Yeah.
and sleep apnea
Yeah.
have to do
I was
with
listening to
the
your
nose?
podcast with Keith Day talking about neuropathy and blood flow and nitric oxide. And when he said that, I went, "Oh, now I'm getting ready to put another piece of the puzzle into the equation." Um, Nitric oxide is a potent vasodilator, and nitric oxide is generated and developed in the nose and sinuses.
Mm.
So, if you don't breathe through your nose properly, you
Mm.
won't get the proper nitric oxide into the lungs, which then won't get into the bloodstream, which then won't allow you to vasodilate and get blood flow to these small vessels and nerves. All right? So, it's very important in people then with neuropathy to get a scan, send it to me, see if you have the abnormalities. And if you do, get them fixed so you will breathe well through your nose. That nitric oxide that's developed in the nose will then go to the lungs, into the bloodstream, dilate the vessels, and likely improve your condition. That's as simple as I can make it. So that really helped me when I heard him say nitric oxide, and I just put it all together and said, "Oh yeah, that's another reason why you have to breathe well through your nose." The other thing with sleep apnea,
Yeah.
again, I'm a big root cause guy. If you have sleep apnea, there's one or two problems, or both. You don't breathe well through your nose, or you don't breathe well through your throat, because those are the two areas to breathe in. So what we need to do, and what I do, is to check the nose for abnormalities, fix them if they're present. Check the throat for abnormalities, large tonsils, long soft palate, long uvula, the little worm in the back of the throat, is usually the culprit. And normally, when I do my nasal surgery and a uvulectomy, just a simple uvulectomy where I trim the uvula, I have gotten people off CPAP that they've been on for 18 and 20 years. Why? Because I've gone back to the root problem, whereas before, these people skipped over the root problem. They were put on a mask without knowing if the nose was open, or they might get this new Inspire implant that's being advertised. And I don't know
Oh,
if they
yeah.
screen people first to see if the noses and the throats are normal. They should, but I don't know anything about that. And maybe they do. I hope they
Mm-hmm.
do. Before you get an Inspire, before you get a CPAP mask, you need to make sure your nose and your throat are normal. It's just common sense. And for the millions of people out there who have sleep apnea, I'm going to bet the majority of them have bad noses, because what happens is when you put a CPAP mask on a bad nose that's obstructed or partially obstructed, you have to turn the pressure up so high that it's uncomfortable, and then they don't use it. Since we're talking about that, let me just tell you what I've been
Mm-hmm.
working on. We just had a presidential debate, right? And everybody's talking about how bad President
Mm-hmm.
Biden did. President Biden has sleep apnea, okay? He was put on a CPAP
Mm.
mask, okay? I'm pretty sure, I can't guarantee it, I'm pretty sure that nobody has really examined his nose and his throat thoroughly to see if he has abnormalities. Because if they did, one, he may not need to use a CPAP. And if he doesn't need to use the CPAP and he's sleeping well through the night, he's going to feel more invigorated during the daytime, have more energy because he's getting good sleep. I'm venturing to guess that he probably doesn't use the CPAP mask, which means he's not sleeping well, which means he's foggy during the daytime. Any one of us would be. It's not his age. No, it's not his age. It would be me. It would be you. It would be anybody who chronically does not get a good night's sleep because they have sleep apnea. They will be sleep deprived within a few days. And when you go years without proper oxygenation to your brain, you will stutter, you will stumble, you will have brain fog, you will not look as if you're clear. And so, what President Biden needs, along with everybody else, he's a sleep apnea patient, is to send me a scan, get it fixed, and be alert and awake and energized. And just like all my patients tell me, when I do that procedure on patients, they will tell me, Dr. Smith, I have so much energy now. I'm getting ready to start running 5K races. I'm getting ready to start exercising. I'm going to do this. I'm going to do that. I can't believe how much better I feel. I just had a woman last week bring her son, her daughter, into my office because she has problems with headaches. But 4 years ago, I did a nasal sinus surgery on her. And 3 or 4 occasions during that exam, she says, Dr. Smith, you saved my life. I was like, come on. She's like, no. Dr. Smith, you gave me my life back. I said, well, what do you mean? She was, Dr. Smith, I was chronically fatigued. I was always having sinus infections. I couldn't breathe well through my nose. I was constantly getting headaches. Since your procedure, I have not had a headache. I have not had a sinus infection. And my energy level is just so much better. She said, I'm better at work. I'm better at home. I'm better. And I said, so you really mean that? She said, oh, my Dr. Smith, I'm telling you, you saved my life. And so after hearing her say that 3 or 4 times, these are the things and the input that I get from patients that keep me going. I've written the White House several times over 2-3 years, trying to get to the president's doctor. Why? Because I care. I want him to be his best. I want him to be his best. It's painfully obvious to me. It's painfully obvious because when he wore his mask, you could see the imprint of the mask on his face. Now you don't see it. See, so I can put it all together. I see it. But anyway, yes, it's associated, nasal abnormalities, sleep apnea, the neurological disorders, autoimmune diseases. It's all connected. It's interconnected. And so the thing that I want to leave with everybody is to have the nose examined, get a sinus scan, get your primary care, order it, and just say, I have some problems breathing and some sinus problems and some headaches, some sinus headaches. And then just send it to me and let's get you well. Let's get you well. The procedure, again, it takes an hour. I'm taking you from not living to living in in 1 hour. And it's covered by insurance. And I just love it. The results are just phenomenal. Yep. I have my work cut out. Rheumatologists, right. Everybody. Mm-hmm. Mm-hmm. Yes. Yeah. And that's another thing, back to the nose and nitric oxide. I mean, think about these prime athletes who are out there. There are a couple that come to mind with me. The quarterback for the Kansas City Chiefs, Patrick Mahomes, he gets teased about his voice. Well, the reason his voice is that way is because his nose is blocked. He has that nasal voice, that hyponasal voice, so his nose is blocked. He needs his nose fixed. That's a $500 million quarterback who is very good, but could likely be very much better. Because studies have shown with regard to athletes, when you optimize their nose and those that have nasal abnormalities, when their noses are optimized and they breathe well through their nose, their endurance to fatigue time and training increases by 50%. 50%. So that's a huge number when athletes that are finely tuned like that, they're always looking for an edge. That's an easy edge. And I've tried to get a hold of him. Everybody thinks when I write to him, I'm trying to do something for me, and I'm not. I'm trying to help the patient. I just allowing you to know what my expertise is and let me help them. But so it's very important. And now the Olympics are getting ready to come on in August in Paris. There's some people who didn't make it to the Olympics that likely could have if they knew and that the status of their nose, if they had abnormalities in their nose that were fixed and they were at their prime. Do you think that a 50% increase in practice time wouldn't have made a difference in the outcome at the Olympic trials? That's the difference between sitting at home during the Olympics and winning a gold medal.
Oh, yeah.
So it's very important. Yeah.
Yeah. Yeah. I'm glad that you made all these different connections because it's true. If you could breathe right, I mean, that's your holy grail. I mean, that's what makes us live. So
that's the basis of everything.
Mm-hmm.
And when you understand about the nitric oxide being produced there, the vasodilation, the sleep, and it just makes sense. I mean, when I go to sleep at night, I don't have time to meditate during the daytime. So what I do is I'll put on some meditation music and I'll lay on my back with my arms across my chest, close my eyes in the dark. And then I'll just start taking some deep breaths. And those deep breaths through my nose helps to get that nitric oxide down into my system, dilate the vessels, increases the blood flow to my brain, And I mean, before I know it, I am out. I am out and sleeping good every day.
So now that you mentioned that, I mean, have you checked your own
Yep.
nose?
Yep. Very good question. I have a deviated septum. I do. It doesn't cause me any problems, but I'm going to get it fixed by one of my colleagues here. I had an appointment with him. He was behind in surgery, so I had to reschedule and I haven't done it. But yeah, I'm going to have him fix
Mhm.
it because why? I don't want to be somebody that down the road develops Parkinson's or Alzheimer's or something like that. I think that's where it might be going. I don't know for sure, but I just want to get it fixed so I don't have a tremor. I don't want to develop any of that. So I'll get it fixed. Very good question.
Ah.
Nobody's asked me that. Yeah.
Awesome. Thank you so
Yeah.
much, Doctor. Anything
Thank
else I
you.
could, how can people work with you?
Well, you can find me by calling the office at 713-795-0600. My website is kevinsmithmd.com. My Facebook page, Smith Center Otolaryngology, has dozens and dozens and dozens of video testimonials and and posts from patients and like the Parkinson's patient. He's just been posting about his recovery. But it'll give you a lot of insight on what I do. And for those that are skeptical, I just say a CT scan that you have nothing to lose. I mean, either you have the abnormalities on the scan or you don't. I had one woman who chastised me on social media. She goes, "You can't cure migraines with surgery. Mine are caused by genetics, and you can't change my genes." I'm like, wow, okay, well, let's just go with this analogy. Scoliosis might be caused by hereditary factors as well, but we don't just leave you with a crooked back. Okay, we fix the back. Same thing with the nose. So, it's all kind of ways to get around to the answer of yes. If you just give me a chance to explain it and just have an open mind, we can get to a common ground where it's just, let's just see.
Yeah,
Let's just see. There's nothing, no harm in just seeing, but don't be combative before we have an exchange of ideas and a discussion. Let's just have a
exactly.
wonderful talk. And I can make it logical where it makes sense to you to look into it at least. Just look into it. Nothing lost with that.
Yeah. Yeah. No, I think that's true. I think if, like you said, it's not going to hurt anybody. So if
Yeah.
you're in that much pain, you would do anything to try to get out of it. And
Yeah.
why not?
Yeah. I
Why not
agree.
try Dr. Smith?
There you go. Kevin Smith. I'm here for you. That's what I do.
Take the ER off.
Okay.
Thank you, thank you, thank you so much, Autoimmune Warriors and others. I really appreciate your support and listening. I want you to be aware of 4 companies. One is Aila Health. They make it easy and helpful to track your lifestyle to reduce flares. But it's more than a tracking app. Aila Health uses data to develop a personalized care plan that works for your life. So why not check it out? Number 2, Adapt Naturals by Chris Kresser. I'm excited to let you know about awhile Multi. It gives you the full spectrum of ingredients that you need to thrive, like essential vitamins, minerals, and phytonutrients. So go to adaptnaturals/DES15. Use my code DES15, DEZ, to get 15% off your first order. And number 3, it is a autoimmune community, Brightly Thrive. Yes, it is an inclusive, fun space to learn, grow, heal, and shine brightly with others that are facing autoimmune challenges just like you. And last but not least is Leap Cure. Check out how you can benefit from their company and what their latest clinical trial is. So, thank you so much and be stronger than autoimmune. Until next time. Guess who I just connected with, Warriors? Leap Cure. Leap what? Leap Cure. Leap Cure connects patients with clinical trials to make research more equitable and efficient. Listen to their latest clinical trial.
If you've been diagnosed with thyroid eye disease and are seeking potential new treatment options, you might be interested in the LIDS clinical trial. If you're 18 and over, have a diagnosis of Graves' disease or Hashimoto's, and are interested in potentially participating in research, you can fill out a short questionnaire at lpcur.com/TED. You'll be connected with someone on the team to determine whether it might be a good fit for you. Check your eligibility and learn more at lpcur.com/TED.